more. Okay. Somebody has. So is it recording now?
It's recording now. Thank you. Can start.
Okay. Okay, can you all see my screen?
Yes, I can see.
Okay. So, okay, we are all welcome to our seminar. So I've titled it Unlock Your Skin's Potential, Rejuvenation and Anti-Aging Masterclass. Can you all hear me?
Yes.
Okay. Just hold on. Okay. So why unlock your skin's potential? So what I have found is that, sorry, hold on, please stop. So what I have found is that a lot of people are not achieving the most with their skin, in the sense that their skin is not at its best point. And most of the time it's because they actually don't know what to do for their skin. So they go on Instagram, they listen to influencers, they hear this, they hear that, but they actually do not have factual knowledge of what to do. And so they are trying things out, they are experimenting, and then you find that the skin is not at its best. So today we're going to talk about how to give your skin the best chance, so to speak. I am Dr. Ifeoma Badre. I'm an aesthetic dermatologist, and this presentation is happening as a partnership between the Aesthetic Clinic, Rejuva Skincare, and Eden Ocean. So this is about me. I have 20 plus years experience in skin care and treatments. I'm a medical doctor with a family medicine specialization. I also have degrees in practical dermatology, cosmetic medicine, and I'm also the founder of the Aesthetic Clinic, Institute of Aesthetics, Beauty Therapy Institute, and Rejuva Skincare. We offer world-class care at Eden Ocean. They're the ones hosting us today at this seminar, and our services are now available at Eden Ocean. We offer internationally recognized aesthetic treatments in a luxurious setting. As I mentioned earlier, we have over 20 plus years experience. We have thousands of happy clients, and we have over 40 treatment options. This may be shocking to some people, but there are actually a lot of treatment options, because you find that a lot of people just stop at facials because that's all they know. I find that when I mention even things as, to me, basic as chemical peels and microneedling, a lot of people have never done these treatments, and it's outstanding that they actually don't know so much about it. So one of the reasons we decided to have this seminar was because Dr. Simbo said that people needed to have a broad view of what aesthetic treatments actually comprise of, in order for them to be able to make a decision to take the next step. So let's try and understand anti-aging treatments for women, because that is our focus today. So there are 4 key insights we'll be looking at for skin health with regards to anti-aging. The first is to understand the science of aging, because it's when you understand the science that you can then know how to go about getting a solution the right way and not have to spend money, time, and resources experimenting and getting it wrong. Then the number 2 question is, can you actually prevent aging? A lot of us have seen Kris Jenner, and she's like 70, but she looks 40. So is she preventing aging or is she treating the aging signs? That's a question that we should ask ourselves. I know that a lot of people say black don't crack, but black can crack if you don't take care of it, So that black don't crack doesn't mean that you should then not take care of your skin and you should go under the sun as much as you like. It just means that we have an advantage in terms of aging slower, but we still do age. Then we're going to look at anti-aging versus rejuvenation. What's the difference and which one should apply to us or to you? Then we're going to look at customized solutions for real results. So let's talk about understanding the science of aging. So when it comes to aging, there are 2 types of aging processes. One is intrinsic aging. The second is extrinsic aging. The difference is that with intrinsic aging, it's a natural process, it's a genetic process. There's reduced collagen occurring naturally. As you get older, there are hormonal changes that you can do nothing about. So it's all coming from the inside. Whatever you're seeing in terms of intrinsic aging, you are born with it. You cannot do anything about this. If your mother is the type that looks old or has skin wrinkles fast, then it's very likely that you also will have that type of skin. If she has erratic hormonal changes, it's likely that you as well would have that. You cannot do anything about intrinsic aging. However, extrinsic aging has to do with environmental factors, your skincare practices, pollution, ultraviolet exposure, lifestyle practices such as diet, smoking, alcohol, and sleep. The good news is extrinsic aging is preventable and treatable. So this is where you can work on. Sorry, hold on. Am I the only one that can let people in? It seems like people are trying to join and I can't see.
I didn't see them. Let me try. Where am I going? Wait, are you able to let them in? I'm not supposed to have a waiting room in this Zoom.
Oh, you don't have a waiting room?
No, I put it on just join. It's funny anybody can be in the waiting room though. Did you see anybody waiting? Let me see. Yeah, everybody's in.
Okay.
I can't see anybody waiting.
Somebody just sent me a message that they were trying to join.
Oh, that could be an internet link because I know I put it on non-waiting. Yeah.
Okay. Okay, let me go ahead then. So we continue with the understanding the science of aging. So aging affects both the skin structure and skin functions. Skin structure changes include slower cellular regeneration and melanin production. So as you get older, your cellular regeneration is slower. So your skin cycle is slower. Instead of every 28 days, your skin renews itself, you find that it takes longer, like 40 days, so even longer. So when it comes to aging as well, skin functions are affected by aging, such as protective barrier function, healing, and tissue repair. Sorry, who is talking? Can you mute yourself? Can you mute yourself? Raymond, can you
It's
mute
Raymond
yourself?
from Good Talk. Something I like to see in the UK. You can mute him, doctor.
Sorry about that. Okay. So the skin, I'm not so familiar with Zoom, so it's kind of like difficult for me. I'm used to Google Teams. Okay, so skin functions that are affected by aging include protective barrier function, wound healing and tissue repair, pigmentary function, and immune response. So I added this because sometimes when I talk to women about skincare and aging, they're always like, oh, I don't care. I don't mind aging gracefully. I don't mind looking my age. But it's more than that. The physiological function of your skin is also affected when you don't have the right practices. So it's not all about vanity and trying to look like Kris Jenner. It's also just skin health, doing the right thing to make sure that your skin is healthy. So like I said before, the good news is that extrinsic aging is preventable and treatable. So if you follow the 4 things I'm mentioning next, you can be sure that you will age gracefully for real. And the first one is to have a balanced diet. That's crucial. A diet balanced where you have antioxidants, vitamin C and E, omega-3 fatty acids, and flavonoids. Now, UV radiation is a major enemy. Practice sun avoidance and sun protection. Use optimal sunscreen. We'll talk about that later, but in general, you want to use sunscreen SPF 50. And then you want to practice sun avoidance. That means even though you have sunscreen on, you still wear a wide-brimmed hat and you still wear protective clothing to make sure that you're protected from the sun, because the UV radiation is a major culprit in aging. Hydration and sleep are essential. So ensure you're taking enough fluids and ensure that you're sleeping well. I used to be very guilty of not sleeping, and I thank God I can say used to, because being an entrepreneur, it's not easy to be sleeping when there's so much to attend to, and I find that I had so many sleepless nights and I'm just working around the clock. But I've had to consciously, as I got older, I've had to consciously just take out time and getting at least 6 hours of sleep every day. And when we say sleep is essential, we don't mean take 2 hours here, 2 hours here, 2 hours there. No, continuous sleep. You should have continuous unbroken sleep. Optimal skincare practices is essential as well. You want to have a good skincare routine. You want to make sure you use retinols or retinoids. What people don't know that the use of retinoids it's an anti-aging secret. Even if you don't have any other active in your skincare routine, have a retinoid. Remember what I said about cellular regeneration and turnover being slower as you get older. Retinoids speed it up. That essentially is what it does. So you must have a retinoid in your skincare routine. Then peptides, the new kid on the block, oxidants, moisturizing your skin properly, and sun protection as mentioned before. Melanin-rich skin. What are the special considerations for us? I'd like to believe that everybody on this seminar is Black, most likely. So what makes our skin special? When I first started my skincare business, I used to think that all skin is skin structure is skin structure, epidermis, dermis, subcutaneous layer. But melanin-rich skin is actually quite different. So from my years of practice, I've seen that actually what works for the Caucasian skin doesn't necessarily work for the black skin. So what are the things that makes us different? Because we have unique characteristics, we actually require a specialized approach to our skincare. What are the strengths we have? We have natural sun protection because we have more melanocytes and therefore more melanin, which is a natural protection from the sun. However, it's not enough for you to say I'm black and therefore I shouldn't wear sunscreen. It's a strength, but it doesn't give you excellent protection. We have a thicker dermis. And so what I find is that sometimes you actually need a higher concentration of actives. Then we have more collagen. This is where they say black don't crack, but eventually it cracks. So you don't want to allow your skin to crack first before you realize that I should have done something. And we'll talk about that later. So those are our strengths. But what are the concerns? Black skin loves to hyperpigment. That same melanin that protects us is the wahala when it comes to skincare, when it comes to our skin concern. Because what you find is that for every time you expose yourself in the sun and you don't have proper protection, your skin gets darker. When you have acne or any inflammation or infection or anything, it will leave a black mark. Any small thing, hyperpigmentation. And we don't want that because it makes us look older. It makes us look like we are suffering. And it's not even aesthetically pleasing. So hyperpigmentation is a big deal. It's a big problem. In fact, in our clinic, it's the #1 problem. Out of every 10 people that come, 6 to 7 of them, their problem is hyperpigmentation. So it is a major concern. Another major concern is keloids. Black skin tends to scar very easily and even progress to keloids in some people, which is very, very distressing because there's really no treatment for keloids. Yes, we can inject triamcinolone and use scar gels, but it never really goes. So it's a big concern. And of course, uneven skin tone. You will find that the color of your face is different from your neck, is different from your thighs, is different. It's just uneven from head to toe. And we found that standard treatments for lighter skin may actually harm darker skin types. So those things that have been invented to treat certain conditions, when you try it on black skin, it will cause more harm than good. So those are the special considerations for melanin-rich skin. So what are the 5 signs of aging? What do you want? 6 signs. What are the things to watch out for? So to say, this person is aging, what are the things that we see that will say, you have aging skin? #1, fine lines and wrinkles. If you look at your skin very closely, you see tiny, tiny lines. They are mostly from dehydration, but that's a sign of aging. Wrinkles, of course, are the ones you see around the eyes, in the forehead, around the mouth. Those are like deep lines. Loss of volume. Look at this picture. Look at this face. You can see the fat storage here, there. The skin looks plump, youthful, it's glowing. But look at here. There's loss of volume here. There's loss of volume here. That's what we mean by loss of volume. It's almost like you're losing the fat on your face. That's a sign of aging. And look at the skin. It's lax. If you pull the skin, it doesn't bounce back the way this one would. So skin laxity is a sign of aging. Pigmentation changes. Look at it. There's some hyperpigmentation here, there. Look at around here. This one is even good though. If you see what some people present with, holy God. Then texture changes. You can see that the skin is not so smooth. Look at this one, very smooth. Look at here, not so smooth. And then dehydration, I spoke about that earlier. You see fine lines. If you look very closely, you can barely see any blemish or line here, but look at here. You can see some fine lines here. So those are the signs of aging. Can you prevent aging? Remember, we can prevent extrinsic aging. And I'll just go about what you should do once again. It's mostly about your lifestyle. So you want to stay hydrated by taking a lot of fluids, diet, exercise, sleep well, no smoking. Smoking is a big culprit in aging. Even if you do all these things and you are smoking, your skin will age very fast because smoking deprives the skin of oxygen. I need not say more. Sunscreen every day, SPF 50 plus. And as you get older, you need to start using professional skincare, med-grade products. Why? Because they contain actives that combat aging. Yes, you can use natural products. I'm not against natural products. I'm not saying organic because the word organic has been abused. In fact, bleaching creams are organic, according to Nigerians. But the point is, you now have to actively understand skincare ingredients and what we call actives that have actually been tried and tested to protect your skin and to ensure that your skin stays younger for longer. So you see that slower cellular regeneration thing we talks about, these actives combat those things. So can you prevent aging? Extrinsic aging, yes. What is rejuvenation versus anti-aging? Because you hear people say, oh, I just want to rejuvenate my skin. What does it actually mean? So rejuvenation is a broad approach to achieving healthier, radiant skin by enhancing its overall appearance. How do you do this? Two ways: use of skincare products and treatments. What are the skincare products you should be using? Antioxidants like vitamin C, E, exfoliating your skin is very important. Moisturizing your skin is very important. Retinoids, those are actives that you should be using. And of course, sunscreen. Then you can do simple treatments like facials, chemical peels, microneedling. Even if you stop at just these three, you have tried, you have really tried. So if you want to keep it simple, oh, I don't want injections, or I don't want anything excessive, or I just want to rejuvenate my skin. We can keep it simple with facials, chemical peels, microneedling, and the use of optimal skincare products. So this has a broad approach to ensuring that your skin is healthy and radiant. What about anti-aging? If you are coming to the party late and you did not do any rejuvenation and the wrinkles have come, it's anti-aging we're talking about now. There's no rejuvenation for you again. Anti-aging focuses on addressing specific aging concerns such as fine lines, wrinkles, fat loss, age spots, skin laxity. All this is to reduce their visible impact. It's not going to take it away. It will just reduce the impact of it. We'll show some before and afters later so you can see what we mean. But you can see this is not even just fine lines again. This is now a wrinkle because it's deep. Can you see? These are wrinkles. These are wrinkles. Wrinkles around the eyes. So she's probably not doing anything. Has never done anything. That's why her face is like this. Now, had it been that maybe she invested in good skincare products and the simple treatments I spoke about, like the chemical peels and microneedling, which microneedling is a very good treatment. It's collagen induction therapy. Her skin would not be like this. It doesn't mean you will not age, or you will still age, but not as fast. Okay, so let's say you are here and you have the wrinkles. What do? You have the wrinkles, the fat loss, the age spots, the skin laxity. Maybe you were even doing rejuvenation, but you still got hair anyway. Maybe you were not. Whatever the case, you are here now. What do? You still have to use medical grade skincare, the retinoids, the peptides. So you go a bit higher in what you're using and use more actives. You're not talking about peptides, exosomes, in addition to the retinoids. And of course, sunscreen. Sunscreen, always there. Your best friend. But now the treatments we're going to offer is not just the chemical pills, the microneedling. Now we go into injectables. So you want to get botulinum toxin injections, aka Botox injections. Those are anti-wrinkle injections. And what they do is to relax the face and get rid of these lines and wrinkles, as in they actually get rid of them by relaxing the muscles so you have a smooth face. Then dermal fillers injections, fat loss that we've been talking about. You can inject into those areas that have the fat loss. You can inject hyaluronic acid. There are different types of dermal filler injections. It could be hyaluronic acid, it could be calcium, lactate, it could be anything. Well, there's even fat injection. You can actually have fat injected back. Whatever the case, the idea is to fill up the areas lost and replace the loss. So you see that there's fat loss here, causing the descent of this area, pulling this down. All this can be filled to give you back that youthful appearance. Then lifting threads can be used. They're literally what it sounds like. They're threads. You put them into the skin and lift it from the side. So literally give you a look like you did a facelift. They don't last as long, but they really do help. And what's best is to do a combination of all. You want to do the Botox here, you want to do the dermal fillers here, and you want to do the thread lift. Doing those three can transform this face and make her look, I am not kidding you, 20 years younger. Of course, there's the option of doing an actual surgical facelift, which may actually be indicated in this client as well, which means they cut, pull the skin and sew it back at the areas where they've cut off the excess skin. And that can take up decades of her face. So now that is what is meant by anti-aging, where you are like actually treating the aging signs that have shown. Let's talk about customized solutions for real results. I want to finish the slides quickly because people might have questions. So at the aesthetic clinic, we have a skincare range called Rejuva. It was curated for skin of color. Each and every one of these products came about as a result of seeing what worked for our clients over the years. Every single product was designed to treat the concerns of Black skin, hyperpigmentation, acne, sensitivity, dehydration. All those things have been taken into consideration, and aging as well. In all that has been taken into consideration in curating this skincare range. We don't have 100 products because you don't need 100 products to achieve healthy, glowing, radiant skin. You just need to know what works. So that is what the skincare line is about. It's formulated for melanin-rich skin with key ingredients like retinoids, niacinamide, hyaluronic acid, L-ascorbic acid, tranexamic acid. These are ingredients you hear about, but you might not, you'll be wondering, which one is good for me? Which one is not good for me? That is the purpose of coming in and getting a consultation. We look at your skin and we are able to tell you, this is your problem. This is what you need. And this is how you're going to use it to achieve clear, flawless skin. Why medical grade? Sometimes I get that questions because people will be like, why are your products not natural? Why are they not plant-based? Well, I don't know how you can get the kind of results that we give from natural products, because we are talking of skin concerns. Like you have a concern, and medical grade products have a high enough concentration and proven efficacy, which under professional guidance will give you the results that you want. They've been tried and tested over and over again to give those results. So that's why we stick to medical grade products. Nothing wrong with using natural products, but will it give you the results you want? Me, I don't know, but I just know that medical grade products work. And we'll show you some before and afters. What are the treatment options there are? So these are broad generalizations. The first step is always to have a consultation and product recommendation. So you want to see a professional who will look at your unique problem and your unique concerns and be able to make a recommendation for you. In as much as coming in clinic to do treatments is very important, what you use every day matters even more. I always give people an example to say, you go to the dentist every 6 months to have your scaling and polishing done, right? But you must brush your teeth every day, So it's the same way. What you use every day matters. Then you go once a month or every 6 weeks to your esthetician to get a treatment for that everyday products you're using. Very important, especially your sunscreen. Facials are very important. Some people will say, what do you even do in facials? So it's not just to wash your face. I can wash my face at home now. It's not like that too. Facials are important because when you go for a facial, your esthetician is actually using professional strength products, number one, and they're using equipment that you may not have at home, like the Hydra dermabrasion tip, the ultrasonic tip. There are things that they are using that you don't use at home. So it's like having a deeper treatment. It's like you're scaling and polishing. Chemical peels. Once people hear chemicals, hey, you want to put acid on my face? It's just the name. It's just a broad term to say, look, we're going to use a chemical to achieve exfoliation on your skin. Because there are many ways to exfoliate. It could be a physical exfoliation when you're using a scrub, or it could be a chemical exfoliation, which is actually what a chemical peel is, which means that we apply a chemical solution to your skin to help your skin to exfoliate fast. So I always give an example. So your take-home product may have 2% salicylic acid, but when you come in clinic, we could do a chemical peel for you with a solution that has 30% salicylic acid. What that would do is give you the results that your product would have given you in maybe a month or 6 weeks. In one day, we achieve that result. You understand? So it's almost like a supersonic way of achieving a result from a particular type of chemical. And it's not as horrid as it sounds. It just, for like 1 week, your skin may be flaking, but what you'd find is that it's the old dead skin that is flaking off to reveal the younger skin under. So it gives you this fresh look and reduces the hyperpigmentation that you may have from exposure to the sun and pollutants and to the environment in general. So it's something that you want to do frequently to ensure that your skin remains or looks younger. Microneedling is my personal favorite because it not only exfoliates your skin or treats skin concerns, but it actually induces collagen in your skin, because as you get older, you lose collagen. So this induces collagen formation in your skin. And what you'd find is that your skin is looking healthier, stronger. That laxity reduces, it looks firmer, bouncier, and more youthful. And when you do microneedling, you actually create microchannels that will allow your products to penetrate and work better. So it's a personal favorite of mine. And there are different kinds of microneedling. Apart from the physical one, there's actually RF microneedling where the needles come with heat. And needles are not as scary as it sounds because we actually numb your skin before the treatment. So it's actually not painful. Then lasers. There's laser hair removal, there's laser aesthetics, there's laser for hyperpigmentation, there's laser for skin rejuvenation. Lasers are the future in aesthetics, honestly, but it's still, we're still learning more about it because it can easily come with complications because the lasers get deeper into the skin. We're no more superficial. We're now talking about going deeper into the skin. So if there's any complication, it's harder to recover from it. But they are very important in addressing skin issues. Then injectables. This is more advanced, and there are all types of injectables. There's the Botox injections we spoke about earlier. There's the dermal fillers. We have injection like policies. A lot of women gather a lot of fat under their chin. We can inject that to kill off the fat cells and give you a more sculpted look. So there are many things you can do with injectables. All treatments are customized to your skin type and your goals. If you say, leave my fat alone, we'll leave it alone. No? It depends on your goals, what you want to achieve. If you say, my only problem is the wrinkles, I just want only Botox, we have to go by what you say. So it's all about what you want to achieve. Because a lot of people tell you, I want to look like myself, or I don't want to look like, I don't want to look frozen. I don't want to look like it's not me. Very possible. Because some people will come and say, I don't want to look like me. I want to look frozen. So we work with your goals. Then there's a lot of talk about regenerative medicine, which uses the body's ability to heal, to create treatment using growth factors, stem cell therapy to repair or replace damaged tissue. So you find things like platelet-rich plasma, which is quite popular with microneedling, exosome-based therapies, topical growth factors. All these are in now. And there's also, it's not proven, but some IV infusions have been found as well. And I'll class them under this regenerative medicine, have been found as well to work quite well, but it's not in black and white yet. Let me put it that way. It's not, there have not been enough tests to support the use of IV therapy in anti-aging. But a lot of people swear by it, and it does work for some people. So here are some before and afters. So this is an older lady, above, I think, 70. She came with a lot of hyperpigmentation over the years. She has never, she started using sunscreen 2 years before she came to us. But of course, you can see that there was already chronic hyperpigmentation from years and years of sun exposure without sunscreen. So we started working on her. This is not the end result because she had to go away after some months. So we actually didn't finish all her treatments, but you can see that her real complexion was already showing, and of course, continuing the skincare would then ensure that she gets to where she wants to be. The same thing here. So this is botulinum toxin injection. So this lady came in with wrinkles, deep wrinkles when she raises her brow. So what Botox does actually is to relax the muscles so that you can prevent these lines. Because what happens is initially you have what we call dynamic wrinkles, meaning that they only show when you are raising your brows. But as time goes on over the years, even when you don't raise your brows, the wrinkles stay. So you want to prevent that by relaxing the muscle so that you get this glass skin look, this relaxed look. People ask, at what age should you start having botulinum toxin injections? I'd say start at age 30, 35 at most, because when it works as preventive, that's when you get the most benefit. To explain it further, let me say, if you start getting Botox injections at 30 and you don't use these muscles, by the time you're 50, you'd be looking maybe 35, maybe 38, because you never actually allowed the muscles to get overused and tired. So this is a big secret in looking younger by the time you're in your 50s and 60s. It's not too late to start. You could start when you're in your 40s. You could start when you're in your 50s. But if you started when you were in your 30s, it's better. The same thing. You can see that for this guy, his dynamic lines are already becoming static. You understand? But if he continues to do the Botox, you'd find that they will gradually fade out with time. And what I've also found is that Botox injections helps the skin to glow. So it does something for the skin as well, not just the wrinkles. It's a treatment I'll recommend anytime, any day. Then we have the dermal fillers. A lot of people do not like these nasolabial folds. And what, like I explained, dermal fillers simply means we use a material, usually hyaluronic acid, to just fill in the areas where the fat has been lost. And you can see that she looks younger instantly. It's quite a popular treatment, this nasolabial. Around the eyes as well is another place that could be filled. And some people do the nose as well, but that's not anti-aging. That one is more like aesthetics. We often talk of the face, but the body is also implicated when it comes to aesthetics. And you find that a lot of people suffer from this, what I call Bolly hand syndrome. Most times they've bleached or used the wrong creams, and your hands will always tell your age, even when your face doesn't. So you also have to take care of your hands. And if for any reason your hands are showing hyperpigmentation, then you also need to do rejuvenation for the hands. And we treat the hands as well. We can do peels for the hands. We can do microneedling for the hands, laser treatments for the hands. What you do for the face, you can do for the body in general. So your custom treatment plan is actually to have a personalized approach to beauty, where you have a comprehensive consultation, a customized plan, and a treatment journey, and ongoing support. So you come to us, we do your consultation, we customize your plan, and you start your journey. No two plans are alike. Yours is uniquely tailored. This ongoing support is very important. We pride ourselves on our customer service. We believe that, you're on a journey, and we take that journey with you. We hold your hand. Because for some people, this is all very new and confusing. So we try to make sure that we are always available to take your calls, to answer your questions, your concerns. We don't sell products to you and abandon you. We are all on the journey together. So that's one thing we work on. It's not just about the aesthetics, it's about the ongoing support. Very important when you're doing aesthetic treatments. So this picture I put here because I find that people think that people that dress like this are doing shakara, just trying to. It's not just that. She is protecting herself from the sun with the sunshades, with the wide brimmed hat, the protective clothing, long sleeve. She is protecting herself from the sun. And she probably has sunscreen on, but like I said, it's not enough. So you need to invest. If you're serious about anti-aging, you need to invest in good sun big sunglasses, big wide brim hats, and wear protective clothing in addition to your sunscreen. Very important. So this just shows your journey in skincare, when you start, you need to stay committed to see the results. And initially to take some resources, money, time, but at this point when you see your results, the commitment required actually goes down a bit, because you've achieved your results. So you actually go into what we call maintenance, where you use less products, you might opt to do less treatments or less intensive treatments because you've achieved that result and you're now going to maintenance phase, which is important as well to maintain, but we've treated you now and then you are just maintaining what you have achieved. So are you ready to begin your journey? This is our website. You can follow us on Instagram if you're not already at Clinic the Aesthetic. This is my Instagram handle, Dr._Abadre. So you can follow us because we educate people a lot about their skin and about aesthetic practices. So are there any questions? I'll be happy to answer any questions you may have. Thank you.
That was fantastic, Dr. Fioma. My goodness me. I must say, I didn't know some of those things you mentioned. Gracious me. So, please, questions, everybody.
Yeah, I have a question. Yes.
Okay.
Okay, so thank you very much, Dr. Abadre. My question is, for me, at my age, the sun has dealt with me. I was diagnosed with lupus and it affected my skin badly. My face is darker than my body because of the effects of the sun. The effects of the sun has affected me so badly that I have scarring on my scalp. My scalp is all white. Now, what would you, because of the lupus, what would you recommend for someone like me? What do I do to get my fit to lighten my skin on my face? I don't want to use any hydroquinone cream. I want something that would naturally bring my color back.
What are you using currently?
Anything that has sunscreen, anything mild. I see right now, I use, sometimes at night, I use shea butter. And then during the day, I use any nice cream that has vitamin C, sunscreen, just, nothing, I can't use anything hard because I know my condition, And I wear a cap. I wear a wide brim hat when I'm going out sometimes, when I remember to take it with me, because of my scalp. So I've been affected by the sun. The sun has affected my condition, my lupus, has made my face darker, so much darker. I look sunburnt.
So my question is, what type of sunscreen are you using? So I found that people that use sunscreen might be using the wrong one that is not even protecting you. And all along, you think you're using sunscreen, but you're actually not.
I just buy a mild cream that just has sunscreen. I buy simple.
You haven't been protecting your skin.
Okay.
So SPF, what are you using?
50 plus.
But you said
SPF,
it's part of.
I went to Zaron the other day and I got the day cream that has SPF 50. And of course, I got some night cream as well, Now, there are products that are coming in for me from South Korea, and a lot of sunscreen products are coming for me. A lot of skincare products are coming for me from South Korea for my condition.
Especially for your condition or just general products?
They're general products, I would say. Yeah, my sister, who is a pharmacist, visited South Korea, and specifically for me, she looked for products that she knows would help my skin. But I haven't tried them yet. That's why I'm happy I joined this this webinar.
So before we even talk about the treatment, let's talk about the prevention, because it sounds to me like you are not even preventing the sunburn. Then again, when you apply your sunscreen, how often do you reapply?
Okay. In the morning when I go out, during the day, I apply my sunscreen in the morning. And then at night, I wash it off and I apply my night cream. And I
Okay, so you
cleanse.
don't
And that's
reapply,
all
you
I
don't
do every
reapply,
day.
so you don't reapply your sunscreen during the day?
No, I've never done that.
But you're
Because
supposed to
I sweat
reapply.
a lot.
No, so
Because
first of all, you
okay.
have not been protecting your skin. You think you have, but you haven't.
Okay.
Because before we even talk about the type of sunscreen, let's even talk of application of sunscreen.
Yes.
Let's assume you have the right sunscreen. You're
Yes.
supposed to apply enough sunscreen. It's not pea size, oh. It's supposed to be so
Wow.
much. When you put it on your face, you look like a masquerade first. Then you rub it in and rub it in and rub it in till it disappears.
I've never done, I have a confession to make. I don't like applying because I sweat. I really, really sweat. So I
So
really don't like applying.
you have the wrong sunscreen, because there are matte sunscreens that when you
Okay.
apply, even reduce the sweating.
Okay, so you can recommend these sunscreens for me then, because it seems to me that no
Yes, for
matter,
sure.
apart from so what you're saying is if I get a skincare product that has sunscreen, I have to put sunscreen extra. Is that what you're saying?
Number one, don't get a skincare product that has sunscreen. Get sunscreen.
Oh, okay. Okay.
That the job is sunscreen. It's not trying to moisturize. It's not trying to put the job.
Okay.
The first job is I am a sunscreen for protection.
Okay.
Then you apply a lot of it in the morning on your face and neck.
Okay.
And then you reapply every 2 hours.
What about the
Yes.
makeup? What if I go out and I'm all made up? Wait. Voila, this
As
is
I'm saying,
interesting.
you have not even been protecting yourself. Talk less of
At
treating it.
all. From what you're telling me, I've not even started. Okay, so
You have not even
let's say I
started.
have a function and I'm all dressed up.
Okay.
And
So,
I'm all made up. What do I
but
do?
but that's not every day, right?
No, that's not every day.
Yes,
So they
it's
can be
okay those
exceptions.
days. Like I said, use enough, but the kind of makeup where his face beats, right?
Okay.
You don't need to reapply, because that's a lot of foundation, which is a form of protection, physical protection.
Yes, I
So on
understand.
those days, it's okay to just apply a lot once until you wash your face. But on the other days, you have to reapply every 2 to 3 hours.
Wow.
Yes.
Which means because sometimes some of us look horrible without makeup. We look tired. As my husband would say,
No
you look
problem.
around. So
If you apply light foundation, which is why I said
yes.
a matte sunscreen can be reapplied on your matte foundation.
Oh, okay. So are you
Yeah, on
going
your
to give
foundation,
us?
you can take a sponge. You can take a sponge and apply your sunscreen on it.
Okay.
For
So
you,
can
or
you
because of
give?
your condition.
Yes. So I
Yes.
need the name
So
of a sunscreen that I should get.
no problem. But let me
Yes.
explain something about sunscreen. You mentioned Korean sunscreen.
Yes.
Now, when it comes to sunscreen, we have physical sunscreen and chemical sunscreen.
Oh wow.
Yes. A lot of these Korean sunscreen and cheaper sunscreens are chemical sunscreens.
Okay.
Why? Because they are cheaper to make. Duh. Who doesn't want to make excess profit, right?
Yes.
However, physical sunscreen is better because the way chemical sunscreen works is when you apply it and you go outside and the sun hits your face, the chemical sunscreen will absorb it.
Okay. So,
I don't like that because it
okay.
instantly makes you look darker, number one.
Yes.
Number
Yes.
two, the sun breaks it down. So in about 1
Uh-huh.
hour, it's gone, which is
Yeah.
also the theory of reapplying.
Yes.
Physical sunscreen is better, but why do people
Okay.
not buy physical sunscreen then if it's better? I'll tell you why.
Okay. So, what is an example of a physical sunscreen
So
that
if
I
you
can
look
get
at the
right now?
ingredients at the back of the, yes, so if you look at the back of the
Okay.
ingredients of the sunscreen and you see the
Yeah.
benzone, avobenzone, something benzone, those are chemical sunscreens. A physical sunscreen will have zinc oxide or titanium oxide or iron oxide
Okay.
written on it. Those three will show
Okay.
that it's a physical sunscreen. But let me tell you why you don't see physical sunscreen all over the place. I mean, they are there, but they give a
Yeah.
white, all the oxides, they give a white cast.
Okay.
Unless they are microionized.
Wow.
When they
How
are
would I know that?
microionized, be
Yeah.
patient, I'm getting there.
Okay.
So when they are microionized, then they give you that physical protection without the white cast. But the problem is that the process of microionizing it is very expensive, which is why
Yeah.
you see many physical sunscreens in the market that will not give you white cast.
Okay.
So, good news.
Yeah.
Rejuva sunscreen. Remember the range I told you about that is curated for black skin?
Okay. Rejuva sunscreen. Yeah.
Rejuva sunscreen has physical sunscreen, chemical sunscreen incorporated into one, and the physical
Okay.
aspect is microionized. And
Okay.
because it's designed for black skin, it's matte and therefore is lightweight and will
Oh,
not
wow.
make your skin oily or sweaty.
Fantastic. It seems is what I need. Where can
Yes.
I get it?
We put our numbers. Okay, let me display the number again.
Okay.
Oh, no, it was a web. Okay. Dr. Olasimbo, how can she?
Sorry, Doctor. Let me post because it's inside
Yes.
the membership partners directory, but I'll just screenshot it
Yes.
again for them to see. Yes, thank you.
Okay.
Okay.
So
Thank you.
now we've talked
Yeah.
about protection. Let's say you now start protecting your skin properly, but you already
Yes.
have hyperpigmentation and you need to treat it.
Yes. I
There
do
are
have
things that
because I'm
treat.
dark.
Yes. So once you start protecting your skin, it will prevent further damage. But the one that is already there, you need to treat it now. So
Yes.
shea butter, I don't know. You might use it at night, but don't use it in the morning, no. It will fry your skin and make
No.
it. Mm-hmm.
Yes. Yes. Yeah.
Okay. Now you could use mild acids that exfoliate. Remember the chemical exfoliation we spoke about?
Yes.
Yes,
Yes.
you don't have to use 10%, but you can use 2%, 1%, mild, because if, from what you have described, your skin is dark and hyperpigmented, it has a lot of dead skin. Do you understand it?
Absolutely.
Yeah, so you need to gently exfoliate and remove all that old dead skin so that the younger
Yes.
skin inside can come out. That's all you need to do. So yeah, you don't want to use hydroquinone, which means that it's going to take you longer to get your results.
Yes.
It's okay,
Yes.
but it's
Yes.
okay, you know. So it's just to actually see you, see the skin, and make a recommendation of what will work for you.
Okay. Okay.
Yes,
Okay.
that's just it.
Okay. I'll get your details. I assume you're
Okay.
in Lagos now. I'll
Yes,
come.
yes, yeah. Okay, no problem at all.
I'll definitely come because really and truly, I look so dark. Look, let me on video.
Like I said, Hyperpigmentation is the #1 problem.
You see,
Okay.
I
Yeah.
look so dark. I'm so sad about it because the darkness makes me look older.
It's treatable.
Yes.
It's treatable.
Thank you. Yes. Yes.
So get in touch with us and we'll sort you out.
Thank you so much. Thank you.
No problem.
Thank you. Thank you.
Okay. Somebody else raised their hand. Enema, did you raise your hand?
Yes, I did. So, good evening, everyone, and thanks for this, Dr. Ifoma. So, I was going to ask, some of these treatments you were talking about, aren't they painful? Like the whole microneedling, those things, they sound very painful to me. And I
No,
think
so
it's too much for just beauty.
when you are relaxing your hair and you're dancing, did you not used to do it? When you are braiding your hair and they are pulling it and pulling it.
That
and
was
for
when we were younger.
but you braid your hair now, and for 1 week you're like, hey, I can't sleep. Oh, hey, don't you bear it?
Yes, but isn't there an easier one?
No, so the thing
Isn't
about
there?
microneedling is that we numb your
Yeah.
skin before the treatment. We will put a numbing cream on your face. You know how you go to the dentist and they numb you before they do the treatment? We numb your skin before the treatment, so it's not painful.
But
And
it will be painful after the treatment. You feel it after the treatment.
Not
When
really.
the numbing cream wears out.
No, after 2 hours, it's gone. It's done. It's actually not invasive. Yeah. Yeah.
Okay.
Anything, even if there's any treatment that hurts, in 30 minutes, 1 hour, it's done. That's it. And remember, you can start with facials and progress. You can start with facials, progress to chemical peels, then you can progress to microneedling. There are many options. Many options.
All right, thank you. I've done chemical peels several in the past.
Okay.
But I still have the whole hyperpigmentation issues. Like, because I know I don't use sunscreen. I always forget. Even when I buy, I forget to use it. I don't know why. So I still have the whole hyperpigmentation, like dark circles under my eyes. But
Wow.
I hope that now that I'm heading to 50, I'll get better so that I don't start looking 80. So I think I'll have to invest a bit more time.
Yes, and what you use every day matters as well. What you use every day matters.
Okay.
As in what you use in the morning, do you use
So I'll reach out to the clinic for recommendations of what to do. Simple things, please. Thank you.
No problem. Are there any other questions? Betty Chukwujeku.
So, sorry, doctor. I was going to ask you something. So, is it really worth taking the collagen drinks? I mean, collagen powder and all that?
Not really. If it's for your skin, no.
It's for, for skin. Okay, get you.
Yes. No, because think about it. It goes through the stomach, digestive system.
So before it gets absorbed, okay, I get you.
Yeah, like what is actually going to get to your skin?
Yes, there, I get you.
What you apply on the skin, because
it's
remember,
better.
the skin is an organ.
Yes, it absorbs it rather than drinking something. I get you. Okay.
The skin is an organ.
Okay.
Yes.
Thank you so
much. Dr. Ify.
Betty Chukwujeku.
I sneaked in.
I saw you. Okay.
No, I don't. It was insightful. I'm doing treatment, but I was listening in. So.
Okay.
Yes, yeah. I'll call you later.
Okay.
Yeah.
Any other questions?
Please, for people that will call you later, will you charge them? Are we paying special consultation? Let me know whether to call later too.
You will find out.
Okay.
Is this Ifoma or Kalfa here?
Yes, he's the one.
I'm here.
You don't have question.
Maybe I'll see you tomorrow by 2.
Okay, so you're picking on your
Okay,
husband.
please book me through for. Okay, sorry, I'll call after. Sorry.
Okay. Okay.
Yeah, I've listened. I've at least. So when I come in, I'll just do my procedure immediately.
Okay. Okay.
Thank you.
Who else? Who else?
Is
Who
it
is
possible to order Rejuva online so that they just deliver it to?
Yes.
Because not
yes.
everybody is mobile. Okay.
Oh,
Okay.
yes, definitely.
So we can just WhatsApp you the orders, right? I can take
Yes,
orders and send
definitely.
you. Okay, I'll take some orders and I will send you the addresses and how many. So you can tell us
Okay.
how much. Okay, thank you very much.
Okay, no problem. Thank you.
Yes, but unless if you're selling, if you're planning to use, I would advise, and this is not me talking on behalf of EP, but I would advise that you actually turn up, get a proper consultation so that you're sure that the product that you use actually does
And
the
okay, yes, and if you cannot come in physically, you can actually have an online consultation. Assuming it's not just sunscreen you want to buy, if you want to actually get proper, because some people want to start with sun protection, so that's fine, you can buy that. But if you actually have a skin concern and you want resolution, then yes, you should do a consultation. It could be online if you can't come in physically. We actually have virtual consultations. You send us your picture so we can see your concern, and then we can make proper recommendations. Okay, I think we've about, who is our Gen Z mommy? No question.
Not at all, ma. No question.
Okay.
Good evening.
Good evening.
Yeah, ma'am.
Okay, thank you very much. Dr. Davidson.
Thanks so much, Dr. Shoma. Has been a real eye-opener. I'm definitely going to come and see you for sure. Some little things I've noticed that could help me. Okay, so thank you so much. It's been a pleasure just having you. Yes, so definitely.
Thank you.
We shall all be
Thank
seeing you. Of
you.
course, we're going to have Dr. Ifeoma at our first retreat. She's going to be offering. We're going to do a complete makeover retreat coming New Year. So she'll be part of the makeover retreat. All the possible therapies will be available at the hotel site for anybody who doesn't have time to go to the clinic. So thank you so much. Have a fantastic
Thank you
evening,
all.
everyone. Thank you for coming, everyone.
Thank you.
Thank you.
Doctor.
Thank you.
Bye. Mhm.
Thank you. Bye.